That nagging cough. You know the one. It's not just a little throw clear from your dog. It's deeper, persistent, almost sounds like it's rattling.
Yeah.
If you've ever worried about that sound, you're in the right place.
Hmm.
Today in the deep dive, we're pulling back the curtain on a condition that could be behind it.
We're diving into bronchiectasis in animals, and while our main focus today will be on dogs, we should also touch briefly on cats, how it affects them.
Okay. And our roadmap for this exploration comes from a detailed document we're just calling pasted text, which is a real deep dive itself into this condition.
Right.
So our goal really is to give you a clear understanding of bronchiectasis, what it actually is, what sets it in motion, how vets figure it out, and, well, most importantly, what it means for our animals.
Exactly. Whether you're a pet parent, maybe you work in animal care, or you're just curious about animal health.
We're here to connect the dots. Okay, let's unpack this term then. Bronchiectasis. What exactly is going on in the body?
So, at its heart, bronchiectasis is a permanent widening, irreversible, of the airways in the lungs. You know, the breathing tube.
Wow.
And while we see it most often in dogs, it can sometimes develop in cats, usually when they have like long-standing lung inflammation, or sometimes even with cancer.
Permanent widening. That sounds like a pretty fundamental change. How does the lung tissue even get to that point?
Well, imagine your airways as, somewhat flexible tubes.
Okay.
In bronchiectasis, the lung tissue around these tubes, which has often damaged itself by ongoing inflammation or infection, it essentially pulls them open, stretches them,
And keeps them that way.
and keeps them that way. This stretching creates a big problem because the normal flow of mucus gets totally disrupted. Mucus gets trapped, it just sits there,
Yeah.
which leads to more damage, and it creates the perfect breeding ground for bacteria.
So it just gets worse and worse?
It becomes a cycle, yeah.
Ah.
The widening makes it harder to clear mucus, which causes more inflammation, which causes further widening, a bit of a snowball effect.
A snowball effect in the lungs. Not good. And I see here there are different ways this widening can look cylindrical or saccular. And it can be in one spot or spread out.
That's right. Cylindrical is more like an even stretching out of the tube shape.
Okay.
Saccular is more like little pouches or sacs ballooning out.
And does that make a difference, practically speaking?
It can, yeah. Those saccular, pouch-like areas can be even better at trapping mucus, potentially leading to maybe more persistent infections in those spots.
I see.
And, yes, it can be localized, just one area, we call that focal, or it can involve multiple areas throughout the lungs. That's diffuse.
Okay, that clarifies the different presentations. Now, who is more likely to develop this? Are we talking specific breeds or maybe age groups we should be aware of?
It's definitely primarily a dog thing. Quite rare in cats, comparatively.
Right.
But, yeah, we do see patterns in dogs. Certain breeds seem more predisposed. Cocker Spaniels are kind of the classic example.
Okay, cockers. Anyone else?
There's some suggestion West Highland White Terriers might also be more susceptible. The research is ongoing there.
And age.
Age is definitely a factor. We sometimes see it in younger animals, usually under a year old, that's often linked to a specific genetic condition called primary ciliary dyskinesia.
Primary ciliary. Okay, we'll need to circle back to that one.
Yeah, we will. But it's also perhaps more commonly seen in middle-aged to older dogs, especially those with a history of chronic lung problems.
So an older dog maybe already had some bronchitis or pneumonia. They're more at risk.
Exactly. That history of those sort of rattling coughs could be a clue.
Got it. So if you have an older dog who's maybe had previous bouts of lung issues, this is something to keep in the back of your mind. What are the key signs then? What might an owner actually see or hear?
The most telling sign is usually that chronic cough. Persistent.
The one we mentioned at the start.
Yeah, and it's often described as moist and productive. You might, get the sense they're actually bringing stuff up when they cough. Mucus.
Okay, a wet cough.
Yeah.
What else?
Other things to watch for? Sometimes hemoptysis, that's actually coughing up blood.
Oh, wow.
Recurring fevers, a noticeable decrease in their ability to exercise, like they get tired really easily.
Exercise intolerance.
Right, and tachypnea, that's rapid breathing. Sometimes even obvious respiratory distress, where they seem to be struggling for air.
Those all sound like serious symptoms, definitely red flags. Are there any less obvious signs that might still be connected?
Yes, particularly if that primary ciliary dyskinesia is the underlying cause.
Ah, the genetic thing again.
Right. In those cases, you might also see a chronic nasal discharge that just never seems to clear up, or even signs of sinusitis, inflammation in the sinuses.
Interesting connection. And what might a vet pick up on during an exam?
Well, listening to the chest, they might hear moist, sort of crackly sounds. We call them crackles, especially when the pet breathes in,
Okay.
or sometimes louder sounds when they breathe out, maybe wheezes, like
Yeah.
whistling sounds. Another clue can be tracheal hypersensitivity, meaning the trachea, the windpipe, is really sensitive if you touch it gently. Often triggers a cough right away.
Okay. So, while that persistent wet cough is a major indicator, there can be other clues, both obvious and subtle. Let's dig into what actually causes this irreversible damage.
Right.
What are the root causes and the risk factors?
Okay, so there are several potential paths. We already mentioned primary ciliary dyskinesia.
Right.
So basically, you have these tiny hair-like structures, cilia, lining the airways. Their job is to constantly beat and sweep mucus up and out.
Like little brooms.
Exactly. But in primary ciliary dyskinesia, there's a genetic defect, so those cilia just don't work properly
Yeah.
right from a young age.
So the mucus doesn't get cleared.
Precisely. Leading to chronic inflammation, infection, and eventually that airway widening, the bronchiectasis.
Okay, so that's one pathway, a genetic one. What about causes that develop later in life?
Yeah, probably the more common triggers are lung infections or inflammatory conditions that maybe weren't fully treated or resolved properly the first time around.
Such as
Things like bacterial pneumonia, chronic bronchitis, or even a condition called eosinophilic lung disease. If these initial problems cause enough damage, enough inflammation, it weakens the airway walls.
makes them susceptible to stretching out.
Exactly. Makes them more prone to that permanent widening.
That really underscores the importance of fully treating any lung issues, doesn't it, to prevent these potential long-term consequences.
Absolutely. Prompt and complete treatment is key.
What other factors can increase the risk? Environmental things.
Definitely. Environmental factors can play a big role.
Yeah.
Things like smoke inhalation.
Secondhand smoke, for instance.
Yes, or smoke from fires.
Mm.
Also, aspiration pneumonia, that's accidentally breathing in food, water, or even stomach contents.
Oh, right.
Injury from radiation therapy, maybe for cancer treatment nearby, and exposure to certain inhaled environmental toxins. All these things can damage that delicate airway lining.
Makes them vulnerable.
Right, more vulnerable to infection and ultimately to developing bronchiectasis. So minimizing those hazards is really important.
Good reminders for everyone. Now, you also mentioned airway obstruction. Here's where it gets really interesting. How can a blockage in one spot cause this widening somewhere else?
Yeah, this is quite fascinating. So if you have a persistent blockage in an airway, maybe from a tumor growing, or even a foreign object like a grass seed that gets inhaled and stuck.
Happens all the time with dogs, right?
It does. So that blockage causes inflammation and maybe pneumonia in the lung tissue beyond the obstruction. That chronic inflammation and infection in that specific area can then lead to bronchiectasis developing there.
Okay, that makes sense for the area behind the blockage.
But what's really key here is the potential delay. The signs of bronchiectasis might not show up until quite a while after that initial blockage or injury happened.
How long are we talking?
It could be months, even years. The damage can develop slowly, silently behind the scenes.
Wow. That delayed reaction is definitely crucial for people to understand. Okay, so let's say a vet suspects bronchiectasis based on the signs, the history. What's the diagnostic process look like?
Well, first, because other things can cause similar signs, like that chronic cough, the vet needs to consider a list of possibilities, what we call differential diagnoses.
Ruling things out.
Exactly. So that list might include recurrent bacterial pneumonia, fungal infections in the lungs, simple chronic bronchitis, maybe even cancer, or that foreign body pneumonia we just talked about.
So it's a bit of detective work. What about lab tests? Can blood work help narrow it down?
Blood tests can give us some clues, yeah. We might see increases in certain types of white blood cells, neutrophils, monocytes, which usually signal infection or inflammation is happening somewhere.
Okay.
Sometimes we see high levels of certain proteins in the blood, globulins. That's called hyperglobulinemia. And interestingly, sometimes we might even find protein in the urine.
Proteinuria, how's that connected?
It could suggest secondary kidney problems, maybe inflammation like glomerulonephritis, potentially linked to the chronic inflammation or infection from the lungs. Shows how systems are connected.
Fascinating. But blood tests alone aren't the answer.
No, they provide supportive evidence, but they don't definitively diagnose bronchiectasis itself.
Okay, so lab work points us in the right direction. What about looking at the lungs directly? Imaging. I see here that standard x-rays are described as insensitive. What does that mean?
It means that, well, While X-rays can sometimes show changes suggestive of bronchiectasis,
Like what?
like seeing airways that look too large or don't seem to taper down normally towards the edges of the lungs, or thickened airway walls. But often, these changes aren't really obvious on an X-ray until the disease is pretty advanced.
Ah, so you could miss it early on.
Exactly. A normal-looking chest X-ray doesn't rule out bronchiectasis, especially in the early stages. It's just not the best tool for picking it up early.
So if X-rays aren't sensitive enough, what is the go-to imaging technique?
Computed tomography, CT scans. They are much, much more sensitive and specific for diagnosing bronchiectasis.
Okay, CT. What are vets looking for on a CT scan?
There are specific criteria. We look for an airway, a bronchus, that's significantly wider than the pulmonary artery running right next to it. In dogs, the rule of thumb is often more than twice the width of that artery.
That's specific, huh?
Yeah. We also look for dilated airways extending way out towards the very edges, the periphery, of the lungs, where they normally wouldn't be seen so clearly. Thickened airway walls are usually visible too.
And those saccular changes.
Yes, those balloon-like, sometimes fluid-filled cystic dilatations. CT shows those much more clearly than X-rays. It really gives a detailed structural map.
That definitely paints a clearer picture. Are there other ways to directly look inside the airways or get samples?
Absolutely. A procedure called bronchoscopy is very useful.
With the camera.
Exactly. A small flexible camera goes down into the airways. It lets us literally see the inside lining. We might directly visualize those widened areas, the saccular or tubular dilatations.
Wow.
And maybe more importantly, bronchoscopy allows us to collect samples right from the lower airways.
Could you do that?
Techniques like bronchoalveolar lavage, BALF, where we flush a small amount of sterile saline in and suction it back out, or simpler tracheal washes.
And what do you do with those samples?
We look at the cells under a microscope, that's cytology. Often we see lots and lots of neutrophils, those inflammatory cells fighting infection.
Okay.
If it's related to that eosinophilic lung disease, we might see more eosinophils instead. And we always culture the samples, try to grow bacteria.
Do you usually find bacteria?
Sometimes yes, often a mix of different types. But interestingly, sometimes the cultures come back sterile, no bacteria grow, even though there's clearly a lot of inflammation.
So inflammation without active infection sometimes.
It seems so. The damaged airways themselves might just perpetuate inflammation. And if we were to look at actual lung tissue, say from a biopsy or postmortem pathology, we'd see those dilated bronchi, definitely inflammation, scarring, fibrosis around the airways, and often changes in the airway lining cells, something called squamous metaplasia.
Okay, so it sounds like a combination of the clinical signs, that advanced imaging with CT, and then maybe bronchoscopy with sampling really gives the most complete picture for diagnosis.
That's generally the approach, yes.
So once bronchiectasis is confirmed, what are the options? How do we manage this?
Well, it depends a bit on how severe things are. For animals that are really sick, maybe having trouble breathing.
Respiratory distress.
Right. Hospitalization is often needed initially for intensive support.
Like what kind of support?
IV fluids, definitely intravenous antibiotics to hit any active infection hard, oxygen therapy if their levels are low, and airway clearance therapies like nebulization and coupage.
Nebulization, that's the mistreatment.
Yeah, delivering fine saline mist, sometimes with medication, directly into the airways helps loosen up that thick mucus. And coupage is a type of chest physiotherapy, gently tapping on the chest wall to help physically dislodge secretions.
Okay. And activity.
Gentle activity, as tolerated, can actually help them clear their airways too. We don't want them completely sedentary if possible.
Now, what about surgery? Is that ever an option?
It can be, yes, in specific situations. If the bronchiectasis is very localized, maybe confined to just one single lobe of the lung.
The focal type we talked about.
Exactly. Or if it's caused by, say, a foreign body or tumor that's caused irreversible damage in one lobe. In those cases, surgically removing that affected lung lobe, a lung lobectomy, might be considered.
And can that cure it?
If the disease is truly localized to that one lobe, a lobectomy can be curative for the bronchiectasis itself. Yes, it removes the damaged tissue entirely.
Wow. Okay. So surgery is a possibility sometimes. But what about medications for cases that are more widespread, the diffuse type, or just not surgical candidates?
Right. Medications are really the cornerstone of long-term management for most cases.
Starting with antibiotics?
Yes. Initially, often broad-spectrum IV antibiotics in the hospital, like ampicillin or enrofloxacin. Then, for longer-term use at home, we switch to oral antibiotics.
Which ones work best?
We need broad-spectrum ones that penetrate lung tissue well. So combinations like enrofloxacin plus clindamycin or maybe amoxicillin clavulanate are common choices. Azithromycin is another one that could be quite useful.
And how long do they need antibiotics?
This is one of the tricky parts. Often it's long-term, maybe 2 months initially, but sometimes it needs to be lifelong or pulsed on and off.
Even if you don't find bacteria on those cultures.
Yes, even then. It's thought that the damaged airways themselves can harbor low levels of bacteria or just perpetuate a cycle of inflammation that antibiotics help control, even if we can't easily culture organisms. It's managing that chronic inflammatory state.
That's interesting. What about other meds, things to help breathing?
Bronchodilators, like extended-release theophylline, are sometimes used. They might help open the airways a bit.
But the widening is permanent, right?
Right, so they don't fix the underlying problem, but they might provide some symptomatic relief for airflow limitation, and if there's an eosinophilic component.
That eosinophilic lung disease.
Yeah. Then glucocorticoids, steroids, are crucial to reduce that specific type of inflammation.
And those airway clearance things, nebulization, coupage.
Absolutely vital for long-term management at home, helping physically clear that mucus is key.
So it's a real multi-pronged attack. Antibiotics, maybe bronchodilators or steroids, plus physical therapies. Are there any medications that should be used cautiously or even avoided?
Yes, definitely some important interactions and contraindications.
Like what?
Well, using theophylline, the bronchodilator, together with fluoroquinolone antibiotics like enrofloxacin, that combination can cause theophylline levels to get dangerously high.
Okay, good to know.
Also, diuretics, like furosemide water pills, should generally be avoided
Why is that?
because they can dehydrate the patient overall, which includes making those airway secretions even thicker and stickier, harder to cough up,
Makes sense.
and, maybe the most important one, cough suppressants are generally a no-no.
Really. But the cough is the main sign.
I know it seems counterintuitive, but that cough, even though it's chronic and maybe annoying, is the body's main defense mechanism here. It's trying to expel all that trapped mucus and bacteria.
So suppressing the cough would just trap it all down there.
Exactly. It could actually make the underlying infection or inflammation worse. We want them to cough productively, if possible.
That's a really critical point for owners to understand. Okay, so for an animal living with this, what does the long-term follow-up and management look like?
Ongoing monitoring is absolutely essential. Regular vet checkups are key to see how they're responding clinically.
How often?
Depends on the case, but fairly regularly. We'd also likely do periodic blood tests, like a CBC, to monitor for inflammation or infection markers, sometimes repeat chest x-rays or even arterial blood gas tests to check oxygen levels.
And what about prevention strategies at home?
Well, preventing bronchiectasis itself often means aggressively treating those primary lung issues we talked about, making sure antibiotic courses for pneumonia are fully completed, recognizing and dealing with potential foreign body aspiration quickly, properly managing things like eosinophilic pneumonia.
Getting those underlying causes under control.
Right. And once diagnosed, the focus is preventing complications, like those recurrent lung infections, which are a common issue.
And what about the overall prognosis? What can owners realistically expect if their pet is diagnosed with bronchiectasis?
It's really important to understand that this is a chronic condition. It's not going away. Some degree of coughing is likely to be permanent.
Yeah, okay.
However, and this is a big however, with consistent, appropriate treatment and good management at home, many dogs can maintain a really good quality of life. They can live comfortably for months, often years.
That's encouraging.
It is. Animals can be remarkably resilient. But, that said, there's always a risk of things worsening over time, developing severe respiratory failure eventually, or complications if infection spreads.
Like to the kidneys, as you mentioned.
Right, or systemic infection, bacteremia. So, if we kind of connect this to the bigger picture, managing chronic respiratory disease in pets really hinges on early diagnosis, if possible, and a really proactive, consistent partnership between the owner and the vet. That's key for the best possible long-term outcome.
It sounds like it requires real dedication from the owner.
It definitely does, but it can make a huge difference.
Okay. So while it's serious, chronic, with diligent care and working closely with your vet, it can often be managed effectively for quite some time. So what does this all mean? Let's boil it down. For the listener at home, what are the absolute key takeaways from our deep dive today?
I think the main points are bronchiectasis means permanent, irreversible widening of the airways, mostly in dogs. Often stems from previous lung issues or specific conditions like PCD.
Primary ciliary dyskinesia.
Right. The main sign to watch for is that persistent, usually wet productive cough.
Okay.
Diagnosis often needs more than just an X-ray. Think CT scans,
Oh.
maybe bronchoscopy and sampling.
Get the detailed picture.
Exactly. And treatment. It's lifelong management. It involves antibiotics, often long-term, plus those crucial airway clearance techniques like nebulization and coupage. And careful monitoring with your vet is non-negotiable.
But the outlook isn't always grim.
No, definitely not. With that consistent care, many animals can live comfortably for a good long time.
Excellent summary. And on that note, here's a final thought for you, the listener, to consider. Given that bronchiectasis is chronic, involving ongoing inflammation and potential complications, what's the most proactive role an owner can play beyond just giving meds? How much do things like adjusting the home environment, managing exercise carefully, or even nutritional support factor into giving their pet the best possible quality of life alongside their vet's medical plan?
That's a great question to ponder.
Thank you for taking this deep dive with us today. We really hope this exploration has given you some valuable insights into bronchiectasis.
Hope it was helpful.
And we encourage you to continue exploring other fascinating topics in animal health.